And now we're here with Dr. Bilbeisi to talk about colon cancer screening. Hi, welcome to the show.
Hi, thanks for having me.
How are you today?
I'm good.
Good, good.
Yeah.
So there's new recommendations for colon cancer screening.
Yes.
Tell us a little bit about it.
So the screening dropped for just the regular person who doesn't have any high-risk problems. Basically, it went from 50 years old to have a screening test to down to 45.
Oh, okay.
Mm-hmm.
Okay.
And the main reason for that is because there were several studies that were done that found that individuals that had colon cancer under the age of 50, not only was there a higher number of them that were being found, but then over 70% of those individuals that actually had diagnoses of colon cancer under the age of 50 ended up having stage 3 or 4, which is far more advanced, much more complicated, and obviously with a much lower risk of cure, and so, much lower opportunity for cure.
Okay. Definitely this recommendation is more prevention oriented.
Yes, it is definitely meant for the individual who doesn't have any significant risk factors.
Okay.
Obviously, that recommendation continues. So at the age of 45, we recommend that they start screening, and that goes until about the age of 75. Mm-hmm. And then between 75 and 85, it's still kind of a gray zone of who exactly needs to be screened and who, because they're more high risk, or those individuals that may opt to not continue with screening. Okay. And then at the age of 85, the screening ends unless there's a significant problem like a bleed or something like that that would require us to screen them later in life. Okay. But typically by the age of 85, it's recommended that we stop screening individuals that just have, routine medical problems.
Is colon your only focus, or is it
So
your
no, because I work with the Karmanos Cancer Institute here in Mount Clemens.
Okay.
I actually see a variety of different malignant problems as well as benign hematologic issues.
Okay.
Unfortunately, colon cancer is very common, so I see quite a number of individuals in my practice that have it. But they're not the only people I see. I see people with breast, lung, many of the other common cancers, and in fact, we at the Cancer Center see everybody with all cancer forms. And one thing that we found that was unfortunate is that with the individuals that are being found to have the colon cancer before the age of 50, there's really no reason why this is happening. We assume it's something environmental. Maybe through the generations there's been a change in our diet, that we're eating things that are perhaps more carcinogenic, or we're doing something that's more carcinogenic. But we actually don't know why there's more individuals that are being found to have colon cancer before the age of 50. And we also don't know why it tends to be the case for colon cancer, but also for many other cancers like lung and breast, that the younger you're found to have the cancer, it typically is more advanced. Part of that is because we just don't have very good screening methods. So one of the ideas behind the American Cancer Society recommending this drop to the age of 45 for screening was because of the fact that we don't know. So we figured we should just screen everybody. Exactly. Get ahead of it. Make sure that if we can catch it earlier, that we're going to do that. I wouldn't be surprised if in the future they consider pushing it further to the age of 40. Definitely one thing that I didn't really touch on very much was the fact that I'm talking mainly about the individuals that have no symptoms, no risk factors really that we know of. For those individuals that have risk factors, either they have a personal history of bowel disease, they have a family history of bowel disease, particularly colon cancer, they ought to be tested much earlier than the age of 45. For example, if you have someone in your family that had a known colon cancer under that age, that the recommendation is that the other family members be tested 10 years prior to that. Okay. So for example, somebody gets colon cancer at the age of 40, everyone else in that family should be tested at the age of 30.
Okay, that makes sense.
So, so those guidelines the American Cancer Society put out were strictly to change the general population's risk and to decrease the frequency of having more advanced cancer in the general population. But from person to person with family history and their own medical history going into play, the gastroenterologist will take each case by case and decide when and if a colonoscopy is really necessary.
I talk with people that don't realize that it's not okay to not have a bowel movement every day.
Yes,
So
it's very true.
yeah.
I think that
Awareness or education around those kinds of things could probably.
well, and one of the problems is it's obviously not a conversation that anyone wants to have. And of course, many people find it either disgusting or embarrassing.
Right.
And so they don't realize that when it comes to talking to your doctor, it's a totally different conversation than when you're talking to a friend or a family member. That we hope that you would be open and relaxed enough to have those conversations with us and be very frank about your bowel function, particularly because we're asking about it. So if we're asking about it, it's important to us, and we want you to tell us exactly what's going on.
Right. Are there any signs that they should look for that might give them caution around the fact that something might be going on?
Yes. So for individuals that have a personal history of either an inflammatory bowel disease or anemia, oftentimes iron deficiency is one of the first things that we see in this particular illness.
Okay.
And so pretty much anyone with iron deficiency always has a stool test done at the very least to check for any sign of bleeding that might be occurring in the gastrointestinal tract.
Okay.
So with those symptoms, those are usually the most common. Sometimes you can see pain in the abdomen, and that could be the first sign, but typically that's something that we tend to see in people that have more advanced disease or something else is going on in the colon. They go in and they do a colonoscopy and check, and then they happen to see the colon cancers there. The problem is colon cancer in and of itself does not have a lot of symptoms.
Okay.
You tend to see bleeding in some, but not everyone. And it's very rare to actually find someone who had abdominal pain beforehand. So unless they were noted to have iron deficiency, the vast majority of people that we're catching with colon cancer is because of the fact that they had screening testing done.
Okay. And what could a person do to prevent colon cancer? Like, are there some lifestyle or dietary things that you'd recommend?
So it's interesting because there are a lot of new research that's being done kind of in the herbal homeopathic realm, looking at, is there something in the environment that's causing this? The problem is we all carry cancer cells in our body. And it's a question of what is it that causes that second hit that causes us to actually get cancer as opposed to the next person who may have done the exact same things in their life. We know there's definitely a genetic link for some individuals that have colon cancer. And so those individuals that have a higher risk tend to be because either they have had injury to their colon from like inflammatory bowel diseases like Crohn's disease or ulcerative colitis. So keeping those diseases in check can always be very helpful and can prevent any sort of advanced injury that causes cancer. But for the regular individual who doesn't have these other diseases in their colon, obviously eating a healthy diet, high fiber, lots of water. One thing that we found recently is actually eating a lot of foods that have more like meat with charred aspects to it. Over grilling food actually can be, carcinogenic. So we have to be careful about those foods and to try to stick with more like a plant-based diet.
Okay. And I know that probiotics and prebiotics are all the buzz right now. Do you suggest that as a good protocol as well?
So one of the things I didn't mention earlier that could be a tip-off that you have a problem with your colon is actually changes in your bowel habits.
Okay.
So it's not something that we always think about, and it's definitely not something that people usually check on with themselves. But it is important once in a while to kind of get an idea of what is normal for you. Are you having bowel movements regularly? Going for more than 2 days in a row and not having a bowel movement is actually not normal. And change in color, change in texture, these are things that the doctor is going to want to know about when you come in saying that you have belly pain or you have, you want to be checked for colon cancer. Bowel habits are very important. So even though it's not something that we really like to talk about very much, it is something that we try to instruct our patients on doing regularly. And changes in bowel habits can make a big difference. So when we talk about probiotics and prebiotics, really the question is, why are you taking it? Is it because you already have bowel problems? And why is it? Is it because of a medication or is it because of some unknown reason? And if it's the latter, then we really need to look at what it is.
Right. So don't just follow the trend. Yeah.
Exactly. Because one of the things is when we talk about screening, it's not just colonoscopy anymore. There's actually two main kinds of screening. There's where you're actually looking at and examining the stool for blood, or you're doing some sort of direct visualization of the colon, where either you're looking at it from a camera like you do with a colonoscopy, or you're doing a CT virtual colonoscopy. Or even just the flexible sigmoidoscopy, where we only go to the first portion of the colon, or I said the very last portion of the colon, and looking for particular signs for colon cancer. So the first step usually is to do the stool test and see if there's any sign of blood. Because the problem is even if you look back, if it's not something obvious like bright red blood or it's a black stool, that's usually a sign of bleeding internally. Then you have to do something more microscopic, and that's where even looking back is not enough. You have to go one step forward and potentially also have some sort of screening at the age of 45, and that's usually at least a stool test, if nothing else.
Okay. And it seems, I think it has a bad rap, getting colon screened. Is it a difficult process?
So it's interesting because the actual test is very easy because you're sedated. So it's actually the treatment that you have to take beforehand to clean yourself out that is actually the hardest part of the whole process.
Okay.
And it really depends from doctor to doctor what you have, in terms of medication, and what is the process for cleaning out the colon before colonoscopy. So, for example, now I'm not a gastroenterologist, but I'll see patients that said, oh, it's super easy. I took a small concentrated dose of medication with a lot of Gatorade, and that's all I had to do the night before. And I'll have other patients that will tell me, I had to be on a liquid fast, for several days where all I had was liquids. And then I ended up having to fast for like the day beforehand or something like that. So I don't exactly know where the most sensitive way of doing that pre-operative cleaning is going to be, but that's probably better left to the gastroenterologist.
Okay, understood. And so when you have, I know that there's various degrees of colon screening, as you mentioned. But is it considered an operation or
No.
surgery, rather?
You are in an operative suite, but it's usually like an outpatient center or a surgery center, not actually in the hospital in the operating room.
Okay.
So because there's no sort of, there's no cutting that's involved with the colonoscopy other than the potential for a biopsy internally. So it's always a day procedure unless something goes wrong. But it's usually a day procedure where you're in and out the same day, usually in a matter of hours. But because they sedate you, it is a few hours that you're there.
Okay.
It's a relatively painless procedure, though, other than the pre-medications you have to take.
Okay. Yeah, that's very good to dispel the ideas of it being a difficult process. Thank you so much for being here.
Oh, you're welcome. Thanks for having me.
For more information, visit mclaren.org/Macomb Cancer.